Welcome to our event on public policy and advocacy for children with hearing loss who want to use spoken language, listening and spoken language. To run you through a brief Google Meet sort of setup, all of your functions for changing your layout and things like that are in the bottom right corner of your screen. There are 3 vertical dots, and you will be able to change your screen, use full screen, things like that there. You can also turn on captions there if you aren't using the live captioner we've provided. You will see at the bottom center of your window are your main functions. So your mute button, your hang up button, and your turn off and your video on off button. Joni will be speaking for this presentation. Feel free to unmute yourself or text in the chat when you have any questions. She's slotted to speak for about 30 to 40 minutes, but she welcomes any discussion that comes while she's presenting. And of course, there'll be time to ask questions and answer them afterwards. So with that, I will go ahead and introduce Joni. She is the Public Policy and Chapter Relations Consultant for the National AG-Bell, for AG-Bell National. And she also does consulting work for the Duke Cochlear Implant Program. Tonight, she's going to speak about advocacy as it relates to both public policy at the Arizona state level, as well as parent advocacy for our children's education when they have hearing loss or other needs. And go ahead, Joni, take it away.
Okay, great. Thank you so much for that introduction, Stephanie, and for the invitation. I'm really, really happy to be here tonight to talk with you or have a conversation with you. I really do welcome your input. You can use the raise your hand, put in a chat. I may or may not. If I don't see it right away, I'm going to try. I've got my chat open, and maybe Stephanie can nudge me if there is something that goes in the chat. But I just want to tell you first a little bit about my background and how I got to where I am, because that's part of the story. I think that's important when I talk to anyone about advocacy for anything. And my background, my history goes back a lot farther than probably most of all, or if not all of you that are on this call tonight. But I started out in special education. So I don't come from a hearing loss background or professional training in hearing loss. I have learned that over the last 22-ish years. But prior to that, I worked with kids with learning disabilities, young children, and was a diagnostician. But what is important, one of the roles I had on that was, when I was doing that as a teacher and an examiner, was working with parents. And from my very first year out of school, I became very engaged and very committed to parents and the parent perspective related to their children. I was the one who, when a diagnosis was made, I was the one who shared that information with the parents. And I'll tell you, I didn't have a clue what I was doing. I thought I did, but I didn't know. No one had ever trained me. None of my training had, and I would wonder if this is probably still the case today. I was never trained on how do you actually talk to a parent? How do you share news with a parent that is, in their mind, can be devastating, can be the most difficult, painful thing. So my first experience, and then I'm going to fast forward, my first experience was I planned 30 minutes in a room. I didn't have a box of Kleenex. That was a mistake. And I started explaining the results. And to me, this was back in the late 1970s. So back then we used the terms mental retardation, and there was like slow learner, educable mentally retarded, trainable mentally retarded, and severe and profound. They don't use those terms at all, and some of you may have never even heard of them. But this was a child who was in the slow learner, was just a standard deviation. That would have been called educable mentally retarded back then, and it was the classification that you had to use in the schools. And so I was explaining to them about the test, and this mom, I just saw this tear just roll down her face. And I went to myself, oh my gosh, what do I do now? And I ran out and got a box of Kleenex and then came back. And it was 2 hours later that we finished that conversation. But I became extremely committed to parents at that point. And I share that because my whole career has had that as a focus. What do parents need? What do parents want? And how can we support parents? Sometimes to the point where I was reprimanded by public school administrators for giving too much information to parents, which was really wrong. I went to Florida State, got my bachelor's and master's in special education, moved to North Carolina. I live in Raleigh, North Carolina, which is where I am now, and eventually went back and got my doctorate. Looked all over the country and ended up at UNC Chapel Hill because they had a program that I really wanted to go to. While I was in that program, I did an internship in state government with the Exceptional Children's Director, which was my first exposure to public policy at the state level and to the legislature, because I prepared his reports for him when he would go present to the legislature about kids who have disabilities. Fast forward, I had a lot of other jobs. I've been a researcher. I did national research for the U.S. Department of Education in special ed, traveled all over the country. So that was a wonderful place, a wonderful opportunity. But then in 1999, I had an opportunity to become an executive director. And there's a program in North Carolina called Beginnings for Parents of Children who are deaf or hard of hearing. You may or may not have heard of it, but it's been around for a long time. I applied for that job because I thought this is perfect. It brings all of my experiences together and I can learn about the hearing loss piece. Fortunately, the board gave me that opportunity. Beginnings focuses on parents, and everything that Beginnings does, they're still in existence. I was there over 15 years, is supporting parents from the time their child's diagnosed with a hearing loss until the child turns 22 years of age. So Beginnings parent educators are in and out of a family's life at different transitions. One of the hats, many hats that I wore there, I had to bring in the money. And Beginnings, fortunately, over time, the money came from the General Assembly of North Carolina. So it's a line item in the state budget. I had to make sure that money continued. So I had to go down and talk to legislators and share with them what it is Beginnings did. And I was able to tell them that we needed more money and, grow the program and educate them, which is a key word. And anyway, I had to become a lobbyist. Now, how many of you think lobbyists are good? Just hit the raise your hand button. I don't see anybody raising their hand. I see one. Yay. I'm here to tell you that lobbyists are very, very important. And the vast majority of lobbyists, and you can interchange advocate with lobbyists, are really critical to the process because they're the ones that educate decision makers about what needs to happen. So, I'm going to tell you that if you think about your state government, think about the state of Arizona, and you think about your elected officials, they have to make decisions about the prisons, the roads, Medicare, Medicaid, the elderly, the justice system, the environment. I know I'm leaving things out, businesses, insurance, and on and on and on. There's no way that a single legislator, at least I've never met one, can know about all of those things. So it's up to lobbyists to be the ones to educate them. And Stephanie, if you'll go to the next slide, I want to tell you, lobbyists think advocacy. Advocacy permeates everything that each of us does every single day. And so I looked up the definition, and there are lots of definitions, but advocacy is anything that you do to speak on behalf of an issue that's important to you, or a person. It could be your child as a parent. As a professional, it could be the children that you work with. It's anything you do, and we all advocate for ourselves if you think about it every day. We advocate for what we want and need. We advocate for what we think, what our children need or our families need. We we do advocate. And one of the things that we all have as goals for children who are deaf or hard of hearing is to help them learn how to become self-advocates, because that we know is an important skill. So each of you are already advocates, okay? I want you to keep that in mind and think about some of those areas where you find yourself advocating. For those of you who are parents, and I don't know how many of you are parents, I should know that. How many are you parents? Can you hit the raise your hand, because it tells me. Okay, I see, I know 2, 3 of you parents. Excellent. 4, I can't see everybody, so I'm just going, so that's great. So as parents, you are advocating, I know, on behalf of your children. And as they grow, and we'll talk about that a little bit, the advocacy that you have to do for your child becomes even more of a responsibility. But you know that you have chosen for your child who's deaf or hard of hearing to listen and talk. And I applaud you for that, because I think that that's a wonderful thing. And I also want to help you feel better about what it is you do each day to advocate for your child. So that's what I'm talking about tonight. So go to the next slide, Stephanie. I kind of touched on this, and I need to interject and say I had planned to make these slides much more interesting, but some things happened today that I'm going to share with you in a little bit that have to do with advocacy and decision making that completely took my attention away and really occupied actually my gut and my head in not a great way, because of something that happened in another state, not Arizona, but it could be Arizona. So I will share that with you in a minute. So I mentioned before that advocacy equals education. If you think about, I could put lobbying in there. Lobbying is advocacy. Lobbyists advocate and educate about their issue. So one of the things that I like to tell people, and I say all the time, especially when I'm talking to people who don't know anything about kids who are deaf or hard of hearing, is that the good news today is kids who are deaf or hard of hearing can listen and talk. They look like other kids. They're in classes with their hearing peers. They sing, they dance, they give speeches, they play sports. You can look at many of these children and you wouldn't even know they had a hearing loss. The bad news today is that kids who are deaf or hard of hearing look like all the other kids. They do everything that other kids do. They look like a hearing kid. If you don't know that they have a hearing loss, you may not even realize it. But those kids still have needs. There are things that they still have a challenge of being deaf. And there is, it's very important for each of us, myself included, but all of you, to continue to think about how to educate others. And you probably have done this in many of your experiences, but as a parent, whether you're explaining it to your family, to your friends, to your neighbors, to the community, as you advocate, as you ask for, make sure that your child is included in things, you're advocating and asking them, but we're constantly educating others. The general public, and it's hard for me to remember this many times, but the general public doesn't know what we know. They don't know what you know about kids who are deaf or hard of hearing. They don't know kids who are deaf or hard of hearing can hear and talk. They hear deaf child or deaf person, and they automatically think sign language. They don't understand sign language either, but that's what they know. They see interpreters interpreting the Star Spangled Banner at events or interpreting on the news. You say deaf, and I will guarantee that almost every single person in the Arizona legislature, and you'll run across this in many education settings, in schools, as your children move on to public schools, they don't know that kids who are deaf or hard of hearing can listen and talk. That is something that we have to remember to continually tell others every opportunity we get. So we advocate, when I talk about advocacy and talk about what people need to do, people think, well, I can't possibly do that. And what I want to make sure that I'm telling you, and you can go to the next slide, Stephanie, is that you already are an advocate. in everything that you do in this field, whether you're a parent or a professional, you already advocate every single day. And all you need to do now is think about other ways in which you can carry that further. So, the next slide. I'm repeating this. I said it before. Your voice can and should be heard. And I'm here talking to you, whether you're most comfortable advocating at where you are now, or advocating going a little further. If you're a professional, you can advocate for maybe change in practice or change in how things are done. I was talking this morning to two doctoral students in audiology. They're third year, they're getting ready to go out and do their externships for their fourth year. And I was talking to them, and one of them said, well, I'm so busy. We were talking about advocacy. And she said, well, I'm so busy just trying to learn and become a really great clinician. I don't see how I can do this. Now I'll think about it later. And I said, well, she wants to work with adults, and she's probably going to be looking at Veterans Administration hospitals. And I said, you can advocate in your job. You might go there, you're just out of school, you've learned the latest information on technology, on practice, best practices. You may find that some of your colleagues have been out for a while. Maybe they don't know things. You can advocate for change in practice, change in the way things are done, improving things. That is great. That is a great opportunity to constantly be looking for ways that you can make a difference and make a change. But the most important thing is you have to make your voice heard. How many of you know who represents you in the Arizona legislature? Maybe a better question is, if you know who represents you in the House and the Senate in Arizona, raise your hand. I see maybe. Okay, so I'm gonna ask you another question because sometimes this is easier. Oh, yay, Amanda. Do you know who represents you in Congress? Who are your senators and who's the representative in the House of Representatives?
No, just the senators.
That's okay. Senators are good. So I have an assignment for you. This is where goes with your voice can be heard. So here's your homework. Type in Arizona legislature. Usually there will be who represents me somewhere on that site, and you can usually type in your zip code, and it's going to pop up. It will usually pop up, and I'll send a link to Stephanie in case you can't find it. That'll allow you to do it, but it'll pop up your representatives in the legislature, Arizona legislature, and your members of Congress. You need to learn those names, and I share that with you because I'm going to start talking a little bit about how you can make a difference at a bigger level, because you may find that there's something that you think needs to change. So I looked up, one of the issues that I deal with a lot is insurance coverage of children's technology, hearing aids, cochlear implants. I worked on a bill in North Carolina when I was at beginnings to pass hearing aid insurance coverage for children's hearing aids for all children under the age of 22. It passed every committee and both chambers, the Senate and the House, unanimously. Republicans, Democrats, everybody voted for it. That's very rare for an insurance bill, but it can be done. And I tell you that there's a lot that goes to that, and I work with anybody who's trying to get legislation passed. It can happen. Your voice, you can make a difference. If you want something, I have a mom that reached out. She reached out to the Connecticut chapter of AG Bell. She reached out to AG Bell and me. She and her family struggled. Her son needed a cochlear implant. They went round and round, couldn't get it. They were denied by the insurance company coverage. The surgeons worked it out. He eventually got the implant, but he was 2 by the time he got it, and it took 18 months for him to get that implant. She realized how critical that period was. So now this mom wants to see that this doesn't happen to any other family, and she wants to change the system. She wants to make it, and she's already gotten a bill introduced. I don't know what the chances of it are. I'm going to be helping her in the Connecticut chapter with it, but she, on her own, said, I want to make a change. I don't want other families to have to go through what I go through. One person saw something that she wanted to have happen, and she reached out to her legislator. She found out who that was, met him, and he introduced the bill for her. Your legislators, your state and your federal, your congressional, they work for you. They're people. Now, I admit the first time I ever went down to the General Assembly in North Carolina, I was very intimidated and thought, who's going to listen to me? Until I realized, one, the vast majority of them are really great people, and they're in those positions because they think they can make a difference. But they depend on their constituents. That's why I want you to find out who your folks are, and just even send them a little email and say, I just want you to know, as your constituent, if you feel this way, that I really appreciate what you're doing, representing me and representing our district, or representing us in Congress, representing our state. They don't get a lot of thank yous. So I'm a big believer in sending them thank yous, and I could do a whole session and more on just how to talk to them. But I'm encouraging you to meet them, reach out to them, just let them know who you are and that you care. And you may then have an opportunity to talk to them about listening and spoken language, and say, did you know that people who are deaf can hear and talk? Let me tell you about my family. Let me send you a little video. Let me just have a chance to talk to you. I'm finding it's easier now with COVID, or at least before the elections, this last summer in particular, it was easier to get face-to-face time with members of Congress because they were at home. And so they jump on Zoom calls, and if it wasn't them, it was their staff, and staff are fine too. In Congress, most legislators in your state won't have a staff. It'll just be them, and they might have an assistant who answers the phone. They want to hear from you. I guarantee it. You will be amazed. They want to hear from you. They want to know what you think, and you can learn all about them on the legislative website. So that's my challenge to you, my homework for you, is to find out who it is and let your voice be heard. Let your voice be heard. Now, I'm going to tell you how some things where voices were heard. Next slide, Stephanie, that have made a difference. Now, oops, that was advocacy and education again. Advocacy equals education. Here I go. So I'm switching to it. How many of you know the Individuals with Disabilities Education Act? It's IDEA. You don't have to raise your hands. I know some of you know this. This is the law, the federal law, that says children who have disabilities, children who are deaf or hard of hearing, must be provided a free, appropriate public education in the least restrictive environment. It's the law that says, parents, you have certain rights, and your children should receive these services. If you haven't ever, I'm not going to say read that, but go to a site. There's a site I'm going to tell you about. And Stephanie, if you can type this in there, it's called Rights Law, WRIGHTSLAW.com. Rightslaw.com. Go to there if you've never been there, especially you parents, because they will give you, it's just a wonderful site. They have all kinds of information. It's done by lawyers, but they're experts in special education and disability law. To take you back to how this happened, because this law has not always been around. So I mentioned 1978. So in college, it was the original law that preceded this one was called Public Law 94-142, and it was passed in 1975. Prior to that time, children with disabilities, anybody with disabilities, they were basically in institutions. They were not in public schools. They weren't allowed to go to public schools. Schools didn't have to serve them. They didn't have to teach them. And a disability was anything the school decided they didn't want to deal with. So I know when I went to school, even before then, there were some kids that needed speech therapy. They had lisps, but that was it. There were no other kids that had any kind of needs. That law said that is no longer acceptable. That law was passed by people like you, because of people like you, because of organizations like A.G. Bell, because of administrators, because of advocates. Parents were huge in getting that law passed to say, this is wrong. Kids should be in public schools. We have that right. That law has existed since 1975. It has evolved. It has grown. They keep reauthorizing it. There will be another reauthorization. Every time that happens, the next time it happens, AG Bell will be there with some things we want to have in there. We want to get more information in there about listening and spoken language. So that is an important law that you need to know. And as a parent, I'm probably talking way too fast. Sorry. As a parent, and as a professional, becoming familiar with that. This is what allows you to have early intervention. This is what provides you with public schools. As I mentioned way back in the beginning of when I started talking, I told you I got reprimanded for telling parents things that the school didn't want me to tell them. What I told them, they had the right to know. They had the right to know it, but the school didn't want them to know it. And I'll tell you what it was. This was back, I was working with a family and a child who had severe emotional behavioral disorders. And there are different programs. In other words, you meet the needs of individuals based on what their needs are and not because there's an opening in a program. So I would take parents to visit different programs so they could see what the differences were and help make the decision about what they thought was best for their child. Well, I did that with one supervisor, and she left, and another one came, and I got in big trouble because they said, no, you don't ever tell a parent about the programs that are available. We'll place that child wherever we have an opening and wherever we decide it's administratively convenient. Basically, not exactly in those words, but that's what they said. It's one of the reasons I left and went back to get my doctorate, because I was going to come back and change the world, and I took a different path. I can tell you what happened in 1978 is happening in 2021. Parents, don't let that happen to you and your child. You have the right to be involved in any placement decision that is made for your child. If you've been at Desert Voices and you're now in public education, and it only applies to public education, not private, there are things that you need to know that you have the right to have the school provide, and the school has to provide it. They have to do it. So I encourage you to go and find out more about what that is. So next slide. What do you want? Everybody wants something. What do you want? Think about what it is you want. Think about what it is you want for your child's education. Think about what it might be, what you might want for your professional career, for those of you who are professionals. Do you want listening and spoken language recognized as a licensure in Arizona? Do you want to be rewarded in terms of higher pay because of the credentials for those of you who have gotten the listening and spoken language specialist certification? What is it you want? Because you have the right to ask for it. I encourage you to ask for it. And it will help guide you in your decision making. So I'm going to tell you something that happened today, because I alluded to this. So I shared this with Stephanie before when I told her I didn't get my slides made pretty. There's kind of plain. But so today I got an email from one of our colleagues in Indiana, who said, have you seen the legislation that was just introduced in Minnesota? I said, no. She immediately sent me links to the legislation. So the state of Minnesota there are two bills that have just been introduced. One was just introduced Thursday and the one the week before. I didn't know about it because of the way I search. We search all legislative sites every week for using ASL. They never used it in these bills. It's American Sign Language spelled out, so I'm making a change. But one of the bills proposes to amend child abuse and neglect statute law in Minnesota. Under neglect, they're proposing to add the phrase that caregivers who, so these are the conditions under which people would be charged with neglect by social services. And one of them is not teaching children who are deaf sign language. Okay. So think about that. It's Minnesota. Could easily happen in Arizona or North Carolina. So that's one of them. That bill was introduced in both. There was an identical bill introduced in the House and in the Senate. It's a strategy I used all the time. You see which one gets through first. So that bill is very scary. very scary. The other bill that was introduced just on Thursday is a teacher license. It has to do with licensure and certification. And it's requiring all teachers of the deaf and hard of hearing in the state to have level 4 proficiency in American Sign Language. Now, up until now, there's also a certification for oral teachers who use oral listening and spoken language, and their credentials are different. They don't have to have that proficiency. But this bill has a clause in it that says that the licensing commission for teachers will review the certification for oral teachers of the deaf and will consider doing away with it and collapsing all of their certifications into the general teacher of the deaf and require and they would meet the same requirements as all teachers of the deaf. Now, a legislator reading this doesn't have a clue what it means. I will tell you that. They vote on things all the time and they don't know what it means. They only know what they've been told by whoever it was that's behind this bill. And it's pretty clear. It's the deaf community, the culturally deaf community and leaders and advocates there. So I was immediately writing our A.G. Bell chapter leaders, the oral school executive director, other organizations, because this is to make everybody aware. Now, I can do that from where I am, and my role is to do that, to let people know. I can't do anything about it. I don't live in Minnesota. It's a Minnesota issue, and it's up to the citizens of Minnesota to either defeat it, make sure that these bills don't pass, or to ignore it and let it go through. That's why it's so important to keep an eye on an issue and to pay attention to what it is you want. Now, I mentioned maybe it's that you want to have certification. Maybe an oral certification teacher of the deaf would be great. I don't know. I assume insurance coverage for children's hearing aids would be a good bill to have in Arizona. And it's passed in many other states, but not every state has it. So again, I tell you that story not to frighten you or to scare you, although it did. I will tell you, it was like someone socked me in the stomach. I started sweating. I mean, it hit me so hard. I could not believe that kind of a bill, particularly the one on neglect, was introduced, that anybody would introduce something that was like that. I just couldn't believe it. But it's true, and it happens all the time. So what do you want? Figure out what it is, and then the next slide will say, how do you go about and get it? I told you one story about this mom in Connecticut. I'm going to tell you another story about a mom who lives in Colorado. Her daughter, Allie, A-L-L-Y, has microtia, which means she was born without ears and in ear canals. And so she's had implantable surgery for hearing devices. And her mom, Allie, I think is now 10, her mom had to fight to get insurance coverage, to get the surgery, to get the coverage. It was very painful. I mean, she was already dealing with the issues of her daughter's hearing loss and the malformation of her ears, and now she's having to fight to get what she knew was right for her daughter. So this mom has created a bill called Allie's Act, A-L-L-Y-A-C-T. I'm going to be sending more information out. I've sent information out to our chapters, but there's going to be more coming. Allie's Act has been introduced in the Congress, in the House and the Senate, all because of this one mom who said, I am going to change this, and I'm not going to change it just for kids in Colorado. I want it changed for everyone. And it's a bill that, if passed, would require coverage of implantable devices, whether they're we'll get into, but cochlear implants and other implantable devices that would require them all to be covered by insurance, Medicaid, for all children. It's a great bill. It was introduced last year. It didn't pass. A lot of things got stuck. I don't know that it'll get passed this year, but it's got a lot of support from A.G. Bell, ASHA, the American Speech Hearing Language Association, the American Academy of Audiology. Many of the professional organizations are behind it. But what's so amazing is that this is one mom all by herself. She formed a nonprofit called the Ear Community, earcommunity.org. And it's all about her and her daughter, Allie, and her story and what she's done. And she works out of her house, but she is determined. She decided what it is she wanted, which was to make a difference for all parents who are struggling with things the same way she was. And she figured out how to get it. She didn't do it all by herself. In the end, she went out and found out who could help her, both at the state level and then at the federal level. So I tell you that to say, you can do anything. You can truly make a difference in your daily life, child's life, the life of the children you work with. You can make a difference. It's just a matter of finding out a little bit of information. And as I challenged you earlier, it's by starting out, finding out who represents you, or finding out who in the school you need to talk to, who in the school system, in the district you need to talk to, finding out who those are. And then it's a matter of going and advocating, educating the people who need to know about children who are deaf or hard of hearing, hear and talk. Thank you, Erica, for putting the Ear Community link in there. It's got the link to the bill. It's got the link to Allie, the Ear Community. It's a great site to visit just because you can see that it's not, I haven't been there in a few months, but last time I was there, it's not a fancy site. It's not all, slick and bells and whistles, but it's got everything that you need. And it's truly from the heart of this parent. So the next slide, let me wrap up and see if there's any questions here. You're not alone. So I've shared a lot of things. That's my timer. I don't know how to turn it off. You're not, AG Bell is here to help you. Your AG Bell chapter in Arizona, wonderful resource, wonderful support. They are all there. Everybody who's engaged with the chapter, all of you here tonight now have this circle of support. I'm here. I work at the national level, but I am always available to anyone to talk about any questions, whether it's about a school issue or it's about a state issue or a federal issue. You're not alone. AG Bell will help you. AG Bell wants to help you. We appreciate you. We support you. If you haven't been to the AG Bell website, go to agbell.org. There are lots of resources there for you. We are doing, for those of you who don't know, there's a parent hotline that's available. There's a parent chat going on tonight in Massachusetts, similar to what you did in Arizona last month. They're showing the Listening Project and having a parent chat afterwards. That's going on right now. So you're not alone. And if we don't know the answer, if I don't know an answer to something, that's okay. We'll find out. We'll talk to people. If it requires if we need legal guidance, we'll talk to lawyers. We will do whatever we need to help you. The last slide, if you'll go, Stephanie, has my email address on it. Please feel free to write it down. Feel free to write me. Ask me any questions. I'm going to stop talking. I can talk and talk and talk. I'm very passionate about advocacy and policy. I never get tired of talking about it. I love to educate. I love to advocate. And it seems like no matter how many times I do it, and I think, surely by now everybody knows, I come across someone who has no clue. And I get to do it all over again. And that's okay, because if you can't tell, I really enjoy it. So I thank you for having me tonight. I know this has been a fast overview and there's a lot of stuff. There's a lot more in depth that could be done. Maybe we can do it another time if you want. But please, if you have questions, let me know now. Feel free to write me and ask me whatever you want. And don't forget to find out who represents you and let them know that you know who they are. And that you're watching. No, I'm just kidding. And you're watching them. No, I'm kidding. But yeah, they'll love you for it. I guarantee it. You'll get a thank you. They'll thank you for it. Stephanie, turn it back over to you.
Thanks. Now we're gonna flip over to the sort of answer and question and answer portion of the event. Like Joni said, you can email her, but feel free to also speak up right here if you have something that's burning at the top of your ahead.
Or share a story. I mean, I'd love to hear your stories about something that's happened that you think is, that you'd like to share. Love to hear it.
Feel free to unmute yourself and ask away.
And I can't see everybody, so I don't know if you're.
I think if they talk, their video will pop up higher for you. But we'll see. We can test that out though when and if someone asks a question. Erica, did you unmute yourself to ask a question?
I did. Joni, thank you so much. I actually have a question for the group. I'm lucky to know many of you. And I just love that Joni asked the question of, what do you want? I'm curious what you guys want. And I will start. I think that the biggest one that I want is that, I want LISL education to be paid for by our state. And that it's just, there's no barriers, there's no, hurdle. Just like, today I could send my child to the school for the deaf. I wish I could send my child to the LISL, Phoenix, Arizona LISL school. So that's my, that's my want. Does anybody want to share what, and it does not have to align with my want by any means.
Hello, I'm a teacher. I'm a teacher of the deaf at Desert Voices. So I think what I want is kind of what you touched on too, just an awareness about listening and spoken language for our kids. And I find myself kind of having my elevator speech every time I meet someone new about what it is that I do. And I haven't met somebody yet that, unless they're in our field or one of our families or know our families, that are like, oh, I've heard of that before. So when you were saying all that, it totally resonated with me as a big want.
I dream about that too.
I think this is Stephanie. One of my big wants is to be more aware of all of the opportunities for kids with hearing loss in Arizona in general, not just in Phoenix, but who are our partners and who can help us speak out and sort of and have our voices be heard. I know we have a decent population here in Phoenix, but I don't know what that looks like outside of this city. And AG Bell, Arizona is supposed to be an entire state board or chapter. So that's a piece I think I'd really like to learn more about.
This is Deanne Chapman. I'm the executive director at Desert Voices. And not all teachers of the deaf were created equal. And I would like for there to be some certification or designation so that when we are meeting with educators, whether it's the state school or a school district, that they understand that there really is, it's very specialized, and to say that they have the resources or the knowledge to educate children in listening and spoken language. Parents should understand that may not necessarily be the case.
That's great.
Can I share something that I learned tonight in my parent-teacher conference? Hi. My name is Erin. My daughter is Kendall. She's running around here, so I'm chasing her. Sorry. So it was interesting because I know a lot more now, obviously, but before my daughter was born, I knew nothing, like kind of the theme of the conversation, right? So I was kind of surprised, and my child's kindergarten teacher, she's been teaching for 25 years, and we kind of had the whole team on for her conference just so everybody could be on the same page. She's losing some of her hearing, and you know, we're not preparing for cochlear implants, but we are preparing for a cochlear implant conversation. But I was surprised because her teacher said, in 25 years, I've never had a child with hearing aids or hearing loss. And I don't know. It's just, I'm a teacher as well, not that long, but I've never had a child with hearing loss either. So I just feel like it's been a hard transition for her to teach my child who, you know, came from Desert Voices and had such a great background and foundational skills. She went into school with such an advantage. So it was just surprising. So I wish we had, I feel like there's a big gap there still, if that makes sense. I don't know if anybody else feels that way.
Yeah, I think, Erin, it's a great reminder. It kind of touches back on where Joni started, which is, you know, advocacy, right? It's like and you know, Audrey even touched on it too, right? Like having the elevator speech, always being ready to use it, and just remembering that people don't know.
And I think your point too, Erica, and yours, Erin, is important because, you know, we all of us think about hearing loss as so much a part of our lives and so important and so much what we're passionate about, but it's still a low incidence condition. You know, it's not autism, which most everyone has heard about, even outside of the field. It's not a learning disability or ADHD, which affects many, many, many more than hearing loss. It's still fairly low incidence. So and I'm surprised too that someone say in 25 years she's never had a child with hearing loss, but you'll probably run into that again because it is a low incidence condition. And that is why it's so important for the advocacy and the education every year, letting teachers know. And at some point, I think you said your daughter's name is Kendall. I think she said, yeah, Kendall, that she'll be doing that herself and telling her teachers about her story. There she is. Hi, Kendall. So yeah, it is. It doesn't ever end. It is ongoing, and you know, maybe one day that'll change. But for now, I think it's a matter of continuing to advocate and continuing to educate. So you have a great opportunity, Erin, to teach her something. I want to share this with you because I think I have a couple of minutes, but I know this is an aside. So I have this dream. So what I want is for all early intervention and preschool teachers to learn about listening, how to teach listening and spoken language. There's something called the Auditory Learning Guide, which most of you probably know what I'm talking about. They are good, solid, tested, proven skills that every child needs. I don't care whether they have a hearing loss or not. If we were doing that in the early grades, if all kids were getting those skills and instruction in those skills, kids with learning disabilities would certainly benefit. Kids with attention deficit would benefit. There are so many kids that come from low socioeconomic environments where they haven't had a lot of language exposure or they don't get a lot of that at home. Every child would benefit. And then, boy, wouldn't that be a different world? That's my dream and my want. I don't know that I'll see it. I would love to have a school, and that's what I keep telling the Duke. That's one of the Duke visions. I don't know. They're so new. The cochlear implant program there is new. So we still have a long ways to go, but that's one of the visions, to have a school for listening and spoken language that goes beyond just early intervention, but goes up into elementary, middle, and who knows how far. So one day that will be, but that's my want and my dream.
Joni, do you, I Googled it online and there are a few different pictures of the Auditory Learning Guide. Do you know where we can find the official one that's trying?
I'm sure I can send it to you. I found it, it's an image under images in Google, but the one that I know, I can send it to you. I think I probably even have it on my computer. If you don't mind, I'll do that after we finish.
Yeah, no, I found it on images. I just want to make sure it's the up-to-date one and it hasn't been edited since this one's
I think it's probably, is it yellow?
It's multicolored. There's blue
Multi-
and
That's
yellow.
all for different ages and stuff, or different skills. Like,
Yeah,
I can't remember.
awareness,
Yeah.
phonemic level.
Yeah. I think it's the current one. I don't think it's changed much over
Okay.
over
I will
time.
go ahead and
But it's great for everyone to have. But I believe that every child would benefit from having that instruction. So I hope later you figure out what it is you might want, and then go after it. Just go after it. You can get it. You can achieve. I've learned. One of the things I've learned along the way is that if you don't ask for something, you'll never get it. The worst that can happen is someone can say no to me, and then I think, okay, who else can I ask? Or how do I get around that no and find someone who will say yes? I think I remember when I remember when I was teaching that I learned that for every no that you tell a child, you have to tell them 10, you have to give them 10 positives. For every negative, 10 positives. So anytime you say no, there had to be 10 yeses. And I remember I used to try to practice that as I was teaching. And it's hard, but that's true for adults too. They tell you that in sales. For every no, when you try to sell somebody something, you have to go through at least 10 before you're going to get a yes. So you're going to get a lot of no's. And it's the same when we decide what it is we want, is finding that person who will say, yeah, I agree, I want to help. Let me know how. And they'll be there with you. So you have a great team in Arizona. You guys have an amazing chapter, your leaders. I'm so thrilled and delighted to be here. Thank you very much. Go out and do great things.
Thank you. I wanted to thank everyone else who's here. Thank you, Joni. And thank you to our captioner for captioning the event this evening. As I mentioned before, we've recorded the event. I'll be able to send those out with any with the captions from tonight, as well as the text in the box itself, if you guys have lost or need access to the website addresses again. Feel free to email me for those directly, and I can get them your way. If we don't have any more questions, that will be the end of our event. So thanks for joining, everyone.
Thank you.
Yeah. Bye.
Thank you.
Thank you.
Bye, guys.